Just this past week, the Centers for Medicaid and Medicare Services, part of the federal government, said that 500,000 Americans had signed up for insurance under Obamacare during the last special enrollment period. And that's a huge spike for people newly signing up for health insurance under Obamacare. And that's, of course, the result of millions of Americans losing their employer-linked health coverage because of everybody getting laid off and furloughed because of the pandemic. At the exact same time that we're seeing this massive demand for coverage under Obamacare, the Trump administration and Republican governors all across the country have literally been petitioning the Supreme Court to kill the whole law. Right? It's happening in tandem. On the exact same day, we learned about those 500,000 recent signups for Obamacare, where people are trying to get health insurance that way because they can't get it through their employer anymore, because look what's happened to employment in this country. On that same day we got that statistic, the Trump administration asked the Supreme Court to kill the Affordable Care Act altogether, siding with 18 Republican-led states arguing that Obamacare should be struck down in its entirety. The brief filed by the Trump administration explicitly spells out that they really, definitely, specifically want to kill the part of Obamacare that says you have to be given health insurance coverage by a health insurance provider, even if you have a pre-existing condition. They explicitly spell out in the brief that they want people to no longer be guaranteed coverage if they've got pre-existing conditions. They want the whole thing thrown out, including specifically that. But dig into that a little bit, right? We want to really make sure that this thing is going to rip away coverage from people who are already struggling with things like cancer or some other precondition, right? The news would be eyebrow-raising, even in good times. But right now, we are living in the middle of a pandemic that has already claimed the lives of close to 130,000 Americans. And how many Americans have been infected with this thing? I mean, people who got sick with coronavirus, a lot of them face the grim reality that they might be left with health problems from COVID that affect them for the rest of their lives. Coronavirus infections are poised to become the next pre-existing condition, right? And if the Trump administration has its way, pre-existing conditions will be used to deny you health insurance coverage. This is a point that the Democratic nominee for president, Vice President Joe Biden, has been trying to hammer home.
If Donald Trump has his way, those who have complications from COVID-19 could become the new pre-existing conditions. Some survivors will experience lasting health impacts like lung scarring and heart damage. And if Donald Trump prevails in court, insurers would be allowed once again to strip away coverage, jack up premiums, simply because of the battle they survived fighting coronavirus. Those survivors, having struggled and won their fight of their lives, would have their peace of mind stolen at that moment they needed it most. They would live their lives caught in a vice between Donald Trump's twin legacies: his failure to protect the American people from the coronavirus and his heartless crusade to take health care protections away from American families.
This isn't just political competition between Joe Biden and Donald Trump. I mean, this is the reality that we're living through that is growing every day. By now, 50,000 new cases a day. And here's the New York Times just late this afternoon. Hundreds of thousands of seriously ill coronavirus patients who survive and leave the hospital are facing a new and difficult challenge: recovery. Many are struggling to overcome a range of troubling residual symptoms and some problems that may persist for months, years, or even the rest of their lives. When you think about the number of Americans who already have pre-existing conditions of some kind, right? Obamacare was the way that we made sure that Americans with pre-existing conditions of any kind could still get health insurance in this country. If you think about the number of Americans who are ultimately going to get infected with COVID-19 and survive it, it's just staggering, right? I mean, so far, more than 2.5 million Americans are already confirmed COVID-19 infections. According to the CDC director's recent testimony to Congress, the real number of Americans who've been infected with this thing is probably more like 20 million Americans. But those numbers are going up right now explosively. We've gone from 20, 25, 30, 35, 40, 45, now 50,000 cases a day in the blink of an eye, if we do get to the point where we're up to 100,000 new infections a day, like Dr. Fauci suggested yesterday to Congress, that means we'll have another 1 million Americans infected every 10 days. And that means potentially we're talking about tens of millions of Americans who won't be able to get health insurance. Not now, not ever. Because the Trump administration and Republican governors right now in the middle of this thing are trying to take away the law that says you have to get health insurance coverage regardless of your pre-existing conditions. I mean, Americans have tons of those already, but literally tens of millions of us may have new pre-existing conditions thanks to the other catastrophic, almost existential failure of this administration, which is an absolutely out of control, explosively growing coronavirus pandemic that is infecting 50,000 of us a day now. Good planning, you guys. Good planning. I mean, even Oklahoma voters are giving you the appropriate one-finger salute on this one.